In recent times, three companies are reported for selling harmful products, which are most harmful for children as well as it can cause cancer in human beings. Those three companies were Nestlé, MDH and Everest. And moreover, in MDH and Nestlé products, ethylene oxide is traced, which is a cancer-causing agent.
Indian household masala brands MDH and Everest spices after allegedly finding cancer-causing pesticide in several samples. Reading. The pesticide that has been found in these samples is ethylene oxide, which has been classified as a Group 1 carcinogen by the International Agency for Research on Cancer.
And moreover, for baby products, it is adding sugar, which is the major concern. Now, this is not only a small issue because these are not a small products at all, because these products have customers in huge number. But in fact, their sales were around 2000 crores when compared to the profits in last years. Both the reports came from different regions. Like Nestle report came from Switzerland while the MDS Spice report came from Hong Kong. And exactly after these reports were handed to the government, they came to hear that Nestle Q1 results were declared. So let us understand in detail about this situation and about this product in detail. On 5th April, Hong Kong has released a press note that in Sim Sa Sui, some products related to these brands were taken for a laboratory test. And in those products, the trace of ethyl oxide was found. In MDH products like sambar powder, fish curry, curry masala, these trace of ethyl oxide was found. So, on this concern, the Hong Kong Food Agency had stopped the supply of these unhealthy products in their region. Now, what is this ethyl oxide? So, let us understand about this ethyl oxide in detail. So, basically at room temperature, ethyl oxide is a flammable colorless gas with sweet odor. It is primarily used to produce other chemicals including antifreeze. In small amounts, ethyl oxide is used as a pesticide and also as sterilizing agent. But here we have a major concern because ethyl oxide can cause cancer in long term when it is even used in small quantities. So now the government asked the owners of these products, of these brands, so what is the quality check they are doing for these products on these masalas, everything. Now coming to the Nestle baby products. Cerelac is one of the most famous products of this branded company because of its taste as well as easy making. Just we need to mix with water and our baby food is ready. But is this product is really healthy? As shown in many of our TV ads? The answer is no, because the test has found that the Nestle baby products contain sugar content. According to the Swiss NGO Public Eye report and the International Baby Food Organization claims that Nestle sells baby products with high content of sugar in poorer South Asian, African as well as Latin American countries when compared to other European countries. The report says that 150 baby products are found to exceed the International Food Safety Guidelines for the sugar content levels. Means they are not following the guidelines of the International Food Security for the sugar content level. Coming to Nestle Cerelac, a wheat-based product for 6 months old babies, contain no added sugar in UK and Germany countries. But however in India, it has 2.7 grams of added sugar as per the reports, and also in Philippines, the samples contain up to 7.3 grams of sugar. And this information was not declared on the packaging packets. Means this information was not labeled on the labeling of the product. The product comparison across the globe. Nestle Cerelac for 6 months old babies contains 6 grams of sugar per serving in Thailand, and in Germany and UK the same product had no added sugar. When coming to the global investigation was done, researchers examined about 150 products and found that baby formulas was sold without added sugar in Switzerland, Germany, France and UK. But the unhealthy levels of added sugars in countries like Philippines and South Africa and Thailand were more. Means they are adding sugar in the countries like Philippines, South Africa and Thailand while selling this product. What are the loopholes? The report highlights that while Nestlé follows marketing restrictions in Europe, this exploits the weaker regulations and in lower other middle income countries like the South countries. It is exploiting this loophole of the regularity check.
I'm talking about Nestlé, the biggest consumer goods company in the world. And what have they done? Possibly risk the health of babies in the global south. Let me explain. A big chunk of Nestlé's business is baby food, like infant cereals and formula or baby milk powder. Now in the West, these products follow global guidelines. No added sugar, no honey, no sucrose. Basically nothing sweet. But in the global south, that is not the case.
So now the government needs to take action on this issue. So the Spice Board of India had asked Everest and MDH to provide a detailed report on their quality check, means what type of quality check they are doing in these products. And also India's top food regulator instructed all states to collect the samples of the powdered spices and send them to a random testing and give the testing report to the government within 25 days. Now let us see the Nestlé response on this particular issue. A spokesperson for Nestlé India stated that reducing added sugars is their priority. Over the past 5 years, they have reduced added sugars up to by 30% depending on the product variant, and they eventually trying to reduce the sugar levels in the future also. Nestlé also ensures that its products comply with conduct standards, which was set by the WHO and FAO, and also the local regulations, means it follow all the regulations which are standard and even local regulations also. They emphasize that their infant products are designed to meet the nutrition needs of early childhood, including necessary nutrition like protein, carbohydrate, vitamins and minerals. What are the concerns from the health experts? Dr. Anand Gupta from Breastfeeding Promotion Network of India urges that added sugars make baby formula taste better, encouraging more consumption. This can boost the sales of the companies, but maybe due to the weak regulation, this all happens. Added sugars such as syrups in processed foods are more harmful than naturally occurring sugar in fruits and milk. The WHO also advises against introducing of added sugar before the age of 2 to prevent addictive eating habits, weight gain, obesity, and increase the risk of chronic diseases like type 2 diabetes, heart diseases, and certain types of cancer. And also, high sugar intake at the age of infant can also lead to dental care and poor nutrition intake, as the sugary food often replaces more nutrition options. What are the Indian guidelines on added sugars? Indian guidelines do not set an upper limit for added sugar in infant food. They allow the use of corn syrup, malt, sucrose, fructose, provided sucrose and fructose make up less than 20% of the carbohydrates in the food. And also, the Nestlé claims that to prioritize the reducing of the added sugars and ensurance of compliances with international and local standards. The report highlights the significant disparities in sugar content across different regions and raising concern about the health implications for infants in poorer countries. What are the health risks of added sugars? The WHO advises against added sugars for children under 2 years of age because to prevent the obesity and non-communicable diseases like type 2 diabetes and also heart diseases. Early exposure to sugar can create lifelong preferences for sugary foods and also increasing the risk of obesity and related health issues. Global obesity trends. Since 1990, the global obesity rates have more than doubled. Means the percentage of the obesity in the children and adolescents had tripled, reaching 8% of 5 to 9 years of age. And also, the obesity, once a problem in high income countries, is now a significant issue in rural or poorer nations also, compounding to the challenge of infections, diseases, and undernutrition. What are the ethical marketing concerns related to the added sugars? The investigation found that Nestlé uses social media influencers and a network of the experts and the health professionals to build brand loyalty among the parents. This includes marketing baby formula to infants under 6-year-old. So, what is the Nestlé response on this particular issue? Nestlé stated that the recipe variations are due to the regulations, customer trends, and ingredient availability. They claimed that the efforts are being done to reduce the added sugars by 11% in their infant cereals worldwide. And also they have a commitment towards the guidelines which are set by the WHO in the international level and also at the local standards. They offer the cereals with and without sugar added for various regions. But the investigation by the public eye raises the significant concern about the double standards in Nestlé baby food products containing sugar. While the company defends its practices, the findings highlight the needs for strict global regulations to ensure the health and safety of the infants, particularly in low and middle income countries. Basically, how much sugar does your child need? A doctor explains like this. In the recent study had found that the Nestlé is selling baby products in India with significantly higher sugar contents compared to similar products in developed Western nations. For example, the Cerelac sold in India contains up to 2.7 grams of added sugar as per the serving. This is a concern because infants, toddlers, and very young children do not need added sugars. They get enough natural sugars from breast milk and other natural resources to support their growth and development. For infant and young children, it is especially important to avoid added sugars altogether to ensure the healthy development of their growth itself. So till now we have understood why added sugars should not be given to infants or younger children. Now let us understand the effects of added sugars on infant. Dental health. Added sugar can cause dental damage and cavities for the infants. Weight gain is one of the major issues. High sugar intake increases calorie consumption leading to the weight gain and obesity. Carvings and addictions are also one of the major concerns. Early exposure to the sugar can make infants prefer sweet foods and develop the carvings of sugary foods, leading to unhealthy eating habits in the later in the life. Chronic illness. Childhood obesity increases the risk of developing chronic diseases such as diabetes type 2, heart diseases, and other health issues in the adulthood. So, how can you introduce sugars to babies? Natural resources are use fruits, vegetables to introduce sweet taste. Avoid processed sugars. Avoid giving products which added sugars and opt for homemade alternatives. Healthy snacks. Offer homemade snacks. Use natural sweetness like smashed bananas, apple sauces or dates. Encourage fresh fruit juices instead of packed ones. So conclusion, we can say that Nestlé practice of adding sugars to the baby food in certain regions had raised a significant health concern. Strict regulations and education about this risk of added sugars are essential to ensure the health as well as being for the infant and the children. Parents should prioritize the natural resource of sugar and avoid the processed sugar food. There is a concern about the rising type 2 diabetes among Indian children. Indian children are increasingly being diagnosed with type 2 diabetes, traditionally an adult condition. The key reasons are including are as follows. Obesity. More children are becoming overweight due to the poor diet and less exercise. Unhealthy diets. Many kids eat too many processed food, sugars and fats. Lack of exercise. More screen time and less physical activity lead to overweight and diabetes. Genetics. Family history can increase the risk of this issue. And also early puberty. Starting puberty early, often due to obesity, can increase diabetes risk. And also other factors like poor access to healthcare, nutritious food, and exercise in low-income families add on to this problem. Improving diet, increasing the physical activity, and ensuring the better access to the healthcare can help the people to tackle this issue. In the recent times, we have came with the news that Indigo's Upma contain 83% more sodium than Maggi, claims one of the influencer, and the airlines had responded to this issue. The expert insights is like this. Dr. Sumeria Quasi, one of the consultant pediatrician in Sparks Hospital at Bangalore, highlights that excessive sugar intake in early life can lead to long-term health issues such as obesity and diabetes. And also Dr. Amit, a consultant pediatrician at Mumbai Hospital of Motherhood, emphasizes the risk of added sugar on newborns' blood sugar levels and digestive health, and also explains that breast milk and infant formula already contains the necessary balance of sugar, and additional sugars and disrupt and scripts are not required for the infant systems. Addressing to the rising incidence of type 2 diabetes among children in India requires comprehensive strategies targeting diet, physical activity, education, healthcare access, and socio-economic factors. Promoting health lifestyle behavior for an early age and implementing policies to improve nutrition and increasing the physical activity can help to mitigate the risk of diabetes and improve the long-term health outcomes for children. India, long known for having the highest number of malnutrition children, in now it's facing the rise of childhood obesity levels, potentially becoming an epidemic. Highlights that nutrition literacy is a major issue, with many children consuming high carbohydrates, convincing food instead of balanced diet. This is a major reason for this issue. A striking case is 14-year-old Mihir Jain who weighted 237 kgs in 2017 and had a BMI of 92. After treatment and surgery, his weight reduced to 165 kg. India has been estimated over 18 million overweighted and obese children, with the latest National Family Health Survey showing that 3.4% of children under 5 are overweighted, up to 2.1% in the years 2015 to 2018. Childhood obesity is prevalent across all social classes, but it is more common in urban and wealthier families. Contributing factors include late night snacking, lifestyle, excessive screen time. A 2019 survey by Max Healthcare found that 40% of children and teens in Delhi and its suburbans were overweighted and obese. Despite of the Food Safety Standards Authority of India advertising against the added sugar in the food, concern remaining the sugar contents in the children's food, Nestlé India claims to have reduced the sugar by just only 35%, but not clarity on this issue, because they are saying that still they are working on this issue and they are doing something. Now, Adding to this issue, let us understand the case study of Bonvita. India's child rights body asked Bonvita to remove the misleading ads amid high sugar content claims. The National Commission of Protection of Child Rights had ordered the Bonvita to withdraw all the misleading advertisements, packings, and labels. This followed by a viral video from a social media handle influencer claiming that this drink contains high sugar levels. Despite Bonvita's reputation as a health drink, the Consumer Action Group reported that many such products have high sugar content, misleading labels, and even pesticides residue. So, an investigation found that 70% of the protein drinks were mislabeled and 8% contained pesticides, and also an issue extended beyond Nestlé to other major brands like McDonald's, KFC, which have faced scrutiny for the equality or the quality of the food compared to these international standards. Means these are also not following the standards. Even the McDonald's, KFC, and other foods or other drinks like Bonvita or protein drinks that are not following the international standards or the guidelines they need to maintain to create a protein drink or nutrition food. Now, as a layman or a common man, what we can do as a consumers of these products? Because the food packing often includes nutrition label, but many consumers struggle to understand them. The companies exploit this by making food appearing crunchy and also use bright packing to the products they are making so that they can attract the buyers, manipulating the customer psychology. To address this issue, the food organization must enforce strict regulations and provide clear and transparent, honest advertisements. And also, in turn, the consumers need to educate themselves about the healthy and unhealthy ingredients or the healthy and unhealthy facts to make informed choice. Greater awareness can help ensure better food intake for the families and the individuals. So this we need to take a step ahead, and we ourselves we need to check which food is suits for us and that is good or not good for us. We need to have a check and then we need to take it forward. So guys, that's all for today with this informative content, and for the next time we'll be coming with somewhat more informative content and useful for ourselves. So that's all for today guys, and also do like, share and subscribe this channel, The Life Teachings, and also you can share your feedbacks in the comment section as well. Thank you and have a great